Myself, Dr. Pushpendra Kumar Tripathi, Associate Dean, Pharmacy, AKTU, Lucknow. Today's topic is monophagic liquids, Part 2, preparation of ear drops, nasal drops, enemas, liniments and lotions. We will discuss one by one. Ear drops. Ear drops are liquid preparation or aqueous preparation or suspension or emulsion solution of drugs in water diluted with alcohol, glycerine, PEG, polyethylene glycol intended for the instillation into the ear. Aqueous solutions are not suitable because of the secretion in the ear are mainly fatty and aqueous solution do not easily mix with them. So, container used for the storage glass or suitable plastic fitted with an integral dropper, labeling for external use only, and only 15 ml of ear drop can be dispensed unless otherwise directed by the special order. So, ear drops is used, जैसा कि यहाँ बताया है कि ear drops solution generally aqueous या emulsion या suspension हो सकते हैं. इमल्शन सस्पेंशन वर्ड क्या है अभी बाईफेजिक में क्लियर करेंगे उसको, लेकिन यहाँ जनरली एक्वस नहीं होना चाहिए. एक्वस सोल्यूशन आर नॉट सुटेबल, दिस प्रिकॉशन शुड बी टेक केयर. एक्वस सोल्यूशंस आर नॉट सुटेबल बिकॉज क्योंकि जो सीक्रेशंस होते हैं ईयर में वो फैटी मटेरियल हो सकते हैं. जो सीक्रेशंस हैं वो फैटी या नेचर उनका फैट ऑयली सॉल्युबल हो सकता है. यदि एक्वस सॉल्युबल आप प्रिपरेशन डालेंगे तो वहाँ पर इफेक्टिवनेस कम हो जाएगी एक्वा सोल्यूशन यूज करने में, क्योंकि वहाँ पर मिक्स नहीं होंगे, वो रुकेंगे नहीं, एडेयर नहीं होंगे. इसलिए कोशिश करना चाहिए या तो इमल्शन बेस्ड हो या ऑयल बेस्ड प्रिपरेशन यूज की जानी चाहिए. हाउ टू यूज वार्म द ईयर ड्रॉप्स बॉटल बाय होल्डिंग इट इन योर हैंड्स फॉर ए फ्यू मिनट्स. जब आपको यूज़ करना है तो आपको पहले से बॉटल पकड़ लेनी है, थोड़ा वार्म हो जाए तभी यूज़ करनी है. शेक द बॉटल इफ़ वी आर generally shake the bottle, generally suspension or emulsions we are using here. So, shake the bottle, unscrew the cap of the bottle and draw some liquid into the dropper. Either lie on your side or tilt your head over. आप ऐसे या जिस डायरेक्शन में यूज़ करना है आप वहाँ चले जाइए. Gently pull your ear loop upwards away from your neck and squeeze out the correct number of drops. Keep your head tilt for about 5 minutes so that the drops can be sprayed into the ear. This is important precautions how to use the ear drops. Method of preparation of eye drops. Very nice example of sodium bicarbonate ear drops. Sodium bicarbonate, glycerine, purified water sufficient to produce sodium bicarbonate ear drops. So, this is a composition: sodium bicarbonate 0.75 ml, glycerine 4.5 ml and purified water up to 15 ml. For the during preparation, first of all sodium bicarbonate, freshly boiled and cool purified water. Dissolve the sodium bicarbonate in freshly boiled and cool purified water to avoid the remove the carbon dioxide gas present in the water. That is why freshly boiled and cooled purified water we are using here. Add the glycerine and then make up the volume up to the 15 ml. It is a nice example for the ear drop. Next is nasal drop. There are 3 cavities we are going to use various nasal, ear and eye. Nasal drops are aqueous liquid paraffin solution meant for instillation into the nostrils. It often contain vasoconstrictor drugs to relieve nasal congestion. Oily solutions are not preferred since the oil may retard the ciliary action of the mucosa. So, and container about 10 to 25 ml, colored fluted bottles fitted with screw cap and dropper, such type of container we are using. Here we are avoiding the aqueous solution. Here is a better if you are using the oily solutions are not prepared. There are only aqueous solution we are preferring. So, this as in a ear drop we are avoiding the aqueous solution, but here we are preferring the aqueous solutions. These are the some following properties. A vehicle should have following property: pH between 5.5 to 7.55, buffering capacity, tonicity equivalent to the normal saline, viscosity not exceeding the normal viscosity of nasal mucosa. Sprays are nasal sprays. Similarly, one more preparation, that is a nasal sprays. Then sprays are solution of various drugs in aqueous vehicle and are applied to the mucous membrane of the nose and throat by the means of atomizer or nebulizer. That is why they are known as spray. It may contains antibiotics, antihistaminics, vasoconstrictors, solubilizers and some wetting agents. One example of spray, isoprenaline compound nasal spray, isoprenaline, piperabinine hydrochloride, atropine, propylene glycol, sodium metabisulfate and purified water. These are three are active compounds. This is for as a co-vehicle, and this is a antioxidant, and this is a purified water. So, this is a very nice composition. So, just mix the above all three active ingredients together in purified water, dissolve the sodium metabisulfate, add into the above solution, add other additives, finally add the sufficient pure water to produce 25 ml of this spray. Next is enemas. This is a one more body cavity, that is a very important, used for the various local treatment and used for the defecation of your intestinal or whole GIT tract. Enemas are aqueous oily solutions or suspension that are employed to evacuate the bowel to the influence of general system by absorption or to the affect the locally into the rectum for the cleaning, therapeutic or diagnostic purpose. It is a very useful preparations generally, and they are given at the body temperature in quantities of 1 to 2 pint injected slowly with a syringe. Two types of enemas are used: large volume enemas and small volume enemas. Small volume enemas matlab 0.5 to 1 liter. Example: water, soap and turpentine enemas etc. stimulate the peristalsis movement. Small volume enemas or olive or cheese oil enemas act by lubricating impacted for the faces. So, these two types of enemas generally using, these are very good for cleaning of your intestinal route before the surgery or sometimes to treat that particular region. Container for large volume enemas administered from duff cane and should be warmed to the body temperature before use. A small volume enemas are packed in a disposable polyethylene or polyvinyl chloride bags and sealed with rectal nozzle. Directly you can use by own self, or this is may be used with the help of some health workers are like that. Maybe nurses may be used for the make help during a use of enemas. To be the label should be these precautions: to be burned to the body temperature before use, not to be taken orally and only for rectal use. These labels should be labeled on the container properly. Storage stored in a cool place and complete in darkness, and expiry date is very short. One example: chloral hydrate enemas. Chloral hydrate, mucilage of starch. Mucilage means this is a viscous material of a starch in a water, that is a mucilage. The chloral hydrate 2 gram and mucilage starch sufficient to produce 100 ml. In mucilage we are adding chloral hydrate, the dissolved weight quantity of chloral hydrate in mucilage of starch, then add the sufficient mucilage starch to produce 100 ml. आपको starch mucilage पहले बना लेना है या बना बनाया यूज़ करना है, उसमें chloral hydrate पहले dissolve कर लेना है और फिर उसको 100 ml तक वॉल्यूम मेकअप कर देना है. So, there is liniments. This is one more example of liquid dosage form. Before to discuss about the liniments, there is a two topics I am going to discuss here: liniments and lotions. These are very common words in liquid dosage form, liniments and lotions, and they are used as a external purpose. External purpose means through the skin we are applying in a topical way. They are very clearly indicate they are generally in a category of biphasic liquid dosage form. Biphasic means they are maybe emulsion or suspension. Emulsion or suspension, emulsion means here the two oil are mixed into the oil. No, two liquids are going to mix, means one water or liquid are going, or sorry, oil is going to mix in water or in oil. So, liniments are generally we are here discussing about the liniments are solution mixture of various substances oil or in alcohol solution of soap or emulsion or maybe the semi solid preparation intended for the external application should be labeled accordingly. Because these are generally 99% cases, all emulsions are having some oily medicament, means maybe oils are itself as act as a medicament or maybe some oil soluble material act as a medicament. So, if you want to so very here is a difficult to keep this particular preparation in a monophagic, in a biphagic. If you are keeping this preparation, I am keeping here in a monophagic liquid dosage form, but I am also want to convey this message. This is a very important preparation in a important example of biphagic liquid dosage form, because it is generally that oils are used for the this purpose. So, oils, if we are using the alcohol as a solvent, then they are going to dissolve or maybe become soluble in alcohol. So, alcoholic preparation oil, volatile oils in alcohol. So, they are known as a liniment, but they are such a one of the type of like spirits. So, that time they are monophagic liquid dosage form. Some such type of counter irritant, those are easily soluble in water. So, they may be thus such liniments are maybe the aqueous liniments or solutions liniment, but most of them cases these are biphagic liquid dosage form. Very nice example is a turpentine liniment. Turpentine oil or methyl salicylate we are adding with the turpentine. Turpentine oil is used for the massage purpose, for the remove the just for the inflammation and some joints pains, the turpentine oils are used. So, turpentine oil is never dissolved in water, because water and oil there is a two separate thing. If you want to prepare, then this such preparation is the emulsion. So, liniments are generally emulsions, maybe sometimes they are solutions or mixture of various substances in oil or maybe the alcoholic solution or all material in alcohol. So, only in oil. You take the all solution, all the oil soluble material and use itself oil that may act as a liniment, but as a dosage form that is a emulsions. So, emulsion, when we are to better absorptivity, better efficacy you have to want to make, then they are emulsions. Emulsions are biphagic, heterogeneous thermodynamically unstable system. These are generally oil is dispersed into the oil, any two liquids dispersed to each other by with the help of emulsifying agent, then known as a emulsion. So, emulsion is here, the liniments is a one of the nice example of emulsion. For example, if we are talking about the turpentine liniment, so here the turpentine oil and water, turpentine oil and water. So, there is a need to disperse turpentine oil in a water, one emulsifying agent, generally we are using soft soap. So, always the emulsions suspensions are generally emulsion, but sometimes they be the alcoholic solutions and maybe the or maybe the soap solutions or plain oil, they also act as a liniments, they because they massaged into the skin as a counter irritant, that is why they come to the category of liniments. And so, all the liniments are generally applied with the rubbing or massage into the skin, and they are counter irritant, means when we are applying some part of a body skin, they are some irritation or some is creating, and they are sometimes not only the counter irritant, they are rubefacient also, they produce the redness on that particular space, so that particular region, and they in this way they control the penetration of medicament. They may contain the following ingredient analgesic like methyl salicylate, antimicrobial material, rubefacient, counter irritant, stimulant and smoothing agent. So, major part of this talk is this: the liniments are generally biphagic, emulsion applied externally, always applied with the rubbing and massage. but maybe sometimes they are oil based solutions or alcohol based solutions. Very container used for the storage, narrow mouth screw capped colored bottle, labeled important labeling for external use only, shake well before use because these are emulsions, not to be applied in a wounds or broken skin because they are having counter irritant and rubefacient material. If you are going to apply it in wounds and broken skin, it may create the problem. So, always avoid, and this label is very important on the top of the container, not to be applied on wounds or broken skin, and store in a cool place. Always store in a cool place. Method of preparation. Here is a white liniment, oleic acid, turpentine oil, dilute ammonia solution, ammonium chloride, purified water. See here again the oleic acid, turpentine oil and purified. There is no emulsion, there is no emulsifying agent we are using the preparation of this, but instead some emulsifying agent going to develop. That is why we are using here dilute ammonia solution, ammonium chloride, and here is oleic acid reacting with the ammonia and they form the salt of fatty acid, turpentine oil some fatty acid. So, they are again reacting with the ammonia, they are going to make some fatty acid salt of presence of turpentine oil. So, instead during a mixing oleic acid and turpentine oil, we are adding the dilute ammonia solution and pass the ammonium chloride we are adding, then here the some emulsifying, instead emulsifying is going to develop and this whole preparation is going to become emulsion. So, mix the oleic acid with the measured quantity of turpentine oil, mix dilute ammonia solution with the 45 ml purified water and warm it. Heat it to develop one emulsifying agent with the help of reaction with the ammonia with oleic acid, and then add the warm dilute ammonia solution to oily solution and finally shake and form the emulsion. So, to control the release of ammonia, we are adding extra here ammonium chloride solution. So, dilute ammonia solution may sometimes ammonia may reduce. So, extra ammonium chloride we are adding here to give equimolar solution for the fatty acid and ammonia. They can form fatty acid salt of with the reaction of ammonia and create the instead emulsifying agent and form the one beautiful emulsion, and it is again very useful liniments. One more nice example of liniments generally very useful in the first year, that is a turpentine liniment only, turpentine oil, soap and water. So, just take a turpentine oil and soap. So, soap mixed with the water, add drop wise turpentine oil, no. You turpentine oil first of all mix with the soap and add the water and make a smooth paste. When white paste is developed, then add the remaining volume of water and then in this way the emulsion is formed. Emulsions are always milky in color. If you want to check the preparation is form or not, बन गई है नहीं बन गई आपको पता करना है. So, this give the whitest solution, it means emulsion is going to develop. Whitest means emulsion is formed because emulsions are all generally the simple emulsions, primary emulsions are white in colors. Next very important topic, that is lotion. As I have discussed the liniments, similarly the lotions are maybe the solution, usually liquid suspension, semi-solid preparation containing one or more medicament intended to be applied to the uniform skin without rubbing. This is so lotion liquid suspension. Liquid suspension means again in a biphagic liquid, but I am adding here in a monophagic because some of the solutions are maybe act as a lotion. So, as liniments they are generally emulsions. So, similarly lotions are generally suspension. Suspension means here as the liquid biphagic dosage form classify two types of biphagic liquid dosage form. One is emulsion. Emulsion means oil, water or water in oil, means we are going to disperse oil in a water or water in oil. मतलब एक में water सोल्यूट हो सकता है, डिस्पर्स फेज हो सकता है, डिसकंटिन्यूस फेज हो सकता है, इंटरनल फेज हो सकता है और एक्सटर्नल फेज में भी water oil हो सकता है, water हो सकता है. So you have to keep like this. So emulsions are two types, O by W and W by O. O by W means oil in water. Water is in external phase. We are writing two types of emulsion, O by W. Means what is this is a external phase, this is a internal. It means this is a solute in a very simple word, but in biphasic system this is a dispersed phase, dispersion medium, internal phase or discontinuous. This water is a external phase or dispersion medium or maybe the continuous phase. So there are two types of emulsion, W by O. The both types of lineaments may be applicable. Similarly, but these are thermodynamically unstable system. Here oil and water are not miscible to each other, and that similarly when we are using another type of biphasic liquid dosage form, where insoluble solids we are using for the preparation, insoluble solids, so zinc oxide, kaolin or calcium hydroxide, like this, they never going to become a soluble. So they are known as suspension, means insoluble solid disperse into the dispersion medium with the help of some dispersing agent known as suspending agent known as a suspension. So these are again biphasic, means they are not stable. So these are thermodynamically unstable system, thermodynamically unstable heterogeneous system, where insoluble solids disperse into the dispersion medium with the help of some dispersing agent known as a suspension. So all the lotions are suspension number 1 generally, and all the lineaments are generally emulsion, and sometimes maybe the solution are like that or maybe the semi solid preparation. Important medicaments, they are applied on the skin and always in a skin without rubbing, because they are having insoluble solids and powders material when you are going to the applied. So they may create some scratches on the skin. So they are very important labeling instruction, that is without rubbing. Prepared by triturating the ingredients to a smooth paste and then gradually adding to the remaining, means like just a suspension you are preparing, means take all the powders and take the suspending agent, make a smooth paste with the help of suspending agent and vehicle, and then add the remaining liquid to maintain the volume. But first of all you have to mix properly, enhance the viscosity by the help of, we will discuss one example of the lotions also. Segwell before you, this is important labeling over here, and for external use only, these are two important instruction on the label. Very important example and a very popular example of calamine lotion. Calamine, bentonite, zinc oxide, sodium citrate, liquefied phenol, glycerine, rose water and sufficient protein 200 ml. This is a nice and very popular example of lotions. Here is the ingredients are calamine, bentonite, zinc oxide, sodium citrate, liquefied phenol, glycerine. Individual use, if you want to say what is the use of calamine lotion. Calamine lotions are first of all suspension number 1. They are applied on the skin without rubbing. Here is a individual uses of all ingredients, like calamine is a protective, bentonite is suspending agent, zinc oxide again protective, sodium citrate is a buffering agent, liquefied phenol is a preservative, glycerine is for the moistening purpose, rose water for flavoring. Here we are using zinc oxide and calamine, two in the same category material. Calamine is a zinc oxide and ferric oxide. But we are taking 15 gram of calamine in remaining quantity of 5 gram from the, we are adjusting the quantity of zinc oxide from the externally added zinc oxide, because calamine not only used as a protective here, the ferric oxide giving color over here. So as a act as a coloring agent also. So if we are using the about 20 gram of calamine, its color is not going to become pink or matching with the skin. That is why we are adding the some quantity of zinc oxide to control color, liquefied phenol for preservative, sodium citrate to give pH to control the irritation, it is controlling the skin pH. So how we can going to, so these are the individual uses of the whole preparation. Why we are using zinc oxide externally to control the color. Calamine is a zinc oxide and ferric oxide. How we can prepare? Prepare sodium citrate solution in 70 ml of rose water, triturate the calamine, zinc oxide, bentonite is a suspending agent with the citrate solution, add other additives, finally make the volume with the rose water. So the very important preparation of lotions, calamine lotion very useful. So, these are the related various preparation, whether the monophagic or biphagic like calamine lotion, liniments and some enemas and nasal drops, ear drops, etc. Thank you for the